Assalamu alaikum. I hope so you guys are doing well. So today the topic that I'm going to discuss with you people is about generalized anxiety disorder. So what basically is generalized anxiety disorder? It is a condition of excessive worry about everyday issues and situations and which lasts not more than 6 months. So, what basically is the difference between anxiety and when we are going to say that now this anxiety has been converted into a disorder? So, the anxiety is basically a normal reaction to stress or difficult time. So this means that it's a normal thing to have because there are some ongoing issues in everyday life, so it's normal to have this sort of reaction or stress, and there is always a specific stressor for it, and it has a start and it has an ending point, and it can be helpful or motivational, and it lessens significantly or disappears away from stressful situations. So once the stressor is removed, the anxiety is gone. So and if the person relax it, the person is going to feel better, and it is a response to toxic situation. So it's normal to have this anxiety, but when we are going to call it as a disorder, when it often comes out of nowhere, like there is no a particular trigger or stressor for this disorder, and it is an intense or disproportionate emotional response, and it is ongoing and lasts weeks or months. As the anxiety has a start and ending point, it does not have a start and ending point because it lasts for weeks or months. It actually interferes with everyday life. Physical symptoms are going to be present like sweating, trembling, lightheadedness, racing heart, etc. And it feels impossible to control or manage because this disorder is now not under the control of the body or the brain. So the person is going to be now known as having an anxiety disorder. So, what are the basic symptoms of generalized anxiety disorder? The person is going to have cold, chills, or hot flashes, can have tingling sensation or numbness, shaking or trembling, sweating, chest pain or palpitations, intense fear, abdominal stress, difficult concentrating, and breathing difficulties. So, now when the person is going to have these sort of situations, then or the symptoms are not going to be under that person control, and so the person should not blame himself because he does not know that why it is even why the person is feeling this way. So now the patient needs medication so that these symptoms can be controlled. So now, what actually causes this generalized anxiety disorder? One is it can be a genetic, or there can be some environmental factors, or it can be associated with some depressive disorders like schizophrenia, etc. So the person might be in having some depressive disorders, and that is why the person is having generalized anxiety disorder. So, what is the diagnostic criteria of generalized anxiety disorder? The anxiety and worry are associated with three or more of the following six symptoms. So, these are the following six symptoms. The person should have three or more than three. So, we are going to label the person as having generalized anxiety disorder, and these symptoms should be like not be more than 6 months, and also remember that only one symptom is required for the children. If only one symptom is present, one of these symptoms is present in children, then and at least some symptoms having been present for days, not for more than 6 months, then we are going to say that the child or the person is having internal anxiety disorder. It can be restlessness, being easily fatigued, difficulty concentrating, irritability, muscle tension, and sleep disturbance. So, now what is going to be the treatment of this generalized anxiety disorder? So, we can give the patient SSRIs or benzodiazepines. The SSRIs actually include citalopram, fluoxetine, etc. And benzodiazepines actually have this alprazolam, chlordiazepam, epoxide, or clonazepam, they are widely used as benzodiazepines. And secondly, SSRIs actually stands for selective serotonin reuptake inhibitors. So that's it. I hope you guys have understood this basic concept of generalized anxiety disorder. Thank you so much. If you have liked my videos, do subscribe and comment on this channel. Jazakallah and Allah Hafiz.